Health Watch is presented by UMass Memorial Health Care. Here, caring for you.
Welcome to Health Watch, presented by UMass Memorial Health Care. I'm Brittany Schaefer. Today we're here to talk about sports and energy drinks.
Sports drinks like Gatorade or Powerade or Propel, they contain sugars or carbohydrates, they contain salt, and they contain electrolytes or minerals. The goal of the sports drinks is to replace the losses that you have during really vigorous exercise. So you're trying to replace the things that you're losing when you're sweating. With the energy drinks, the biggest difference is they contain large amounts of caffeine. And sometimes telling the difference can be pretty hard. You have to look at the label to see if there's caffeine contained in the product, but many times they'll actually use the word energy right on the label.
What is in energy drinks?
Well, caffeine's the primary ingredient in energy drinks, and that's really what people are sort of purchasing. That's the effect that they want, is sort of the increased alertness or decreased fatigue. But the energy drinks can also contain things like amino acids like taurine or arginine. They can contain guarana, which is another name for sort of a naturally occurring caffeine. Those are things, though, in terms of the amino acids that we can get in our diets, they don't need to be replaced, and they really haven't had any demonstrated improvement in people's ability to exercise.
Should kids consume energy drinks before and or after sports?
The answer to that is no. The American Academy of Pediatrics has said that children and adolescents should avoid energy drinks really at all times because of the potential harms or hazards associated with caffeine. Instead, if there is rigorous, high-level exercise, if the kids are really working hard out in the heat, then that would be the right time for a sports drink. But at all other times, or really even in those scenarios, water is the preferred method of rehydration.
What are some harmful side effects of energy drinks?
We see kids for things like anxiety. We've seen kids for panic attacks. But in the more serious cases, we can see abnormal heart rhythms or dysrhythmias, and we've even treated kids with seizures associated with energy drink use. Parents might see things like insomnia, irritability, decreased concentration, daytime drowsiness, and all of these are kind of a bad recipe for school time because kids may not be able to focus on what they're learning in school, but they're also undesirable side effects during the summertime as well. The other important piece of the energy drink discussion is that many of the energy drinks are sugar sweetened. So they're an important source of calories for kids and adolescents that may contribute to childhood obesity.
How dangerous is mixing energy drinks with certain prescription drugs?
That's a real area of concern for us because the energy drinks and the caffeine that they contain can amplify some of the undesirable effects of ADHD medications. Again, kids may seem more jittery, shaky, anxious, and they can have some behavioral issues related to the combination of energy drinks and ADHD medications. There's so many adolescents using energy drinks now, occasionally in moderation, sometimes they're using them every day. But the AAP guideline, the pediatricians are telling us that really until adulthood, children and adolescents should be steered away from energy drinks in favor of water and milk because of the health consequences.